Welcome to the Health Channel, all health, all the time. I'm Kathy Buccio, coming to you from the Baptist Health South Florida studios. Now, having a stroke can lead to long-lasting disabilities, including physical, cognitive, and even emotional effects. So that's where stroke rehabilitation comes in. It's so crucial. This hour, we'll be talking about different types of rehab and how each of them works to help stroke patients regain their function. And for some patients, that means being able to walk on their own again. And joining us today is Dr. Lisa Corsa, physical therapist, manual osteopath, and athletic trainer with Premier Therapy Solutions. Welcome back, Lisa. It's so great to have you on.
Thanks for having me back. I appreciate it.
Because I really do love the work that you do. And before we get into that discussion, I want you to tell us a little about your background, how you got interested, particularly in this field.
I graduated from University of Florida and I assisted with the athletic teams. So I loved really helping them get better. When they had an athletic injury or a brain injury, I really improved them, and it just really made me want to become a physical therapist.
Because you see that result firsthand as you're working with them.
You absolutely see the result. The brain can heal, the body can heal. So it just transforms me into a different person to really push them really hard to get better.
Okay, so what exactly is manual osteopathy?
So a manual osteopath really works on the bones. I mobilize and manipulate the bones for proper alignment.
Okay. Now, how does that factor in your treatments when you work with patients?
So when patients suffer a stroke or an injury, they get malaligned. The muscles become weak, the bones become weak. So this assists to realign the patient.
Okay, so you also treat a lot of patients with orthopedic injuries as well, but you also devote a large part of your time with patients who have neurologic conditions as well. So can you explain a little bit about that?
So in my clinic, it is 50% orthopedic and 50% neurological. Neurological patients can be a massive stroke, a traumatic brain injury, or even Parkinson's disease or MS.
Right. And you see a lot of stroke, and that's particularly what we're going to be talking about today, especially about stroke and rehab and life after a stroke. So how common is this?
Strokes are so common. CVAs, a cerebral vascular accident, unfortunately is very common.
Right. And now, what is, I guess we're going to get into this as the show goes on, but when you see these patients, how likely are they to improve and get better?
I would say in my practice, almost all of them really make dramatic improvements with the right therapy. But that's the big difference, and that's what we're going to talk about today, having the right kind of therapy.
And I want to get into the groundwork and what it is that you do. But before we do that, let's see what happens to the brain when a patient has a stroke. So there are two types that we hear about, is the ischemic and the hemorrhagic. So can you tell us the difference between both of these strokes?
Yes, the ischemic stroke is the most common type of stroke. 80% of all strokes are ischemic. This is when there is a blocked blood vessel in the brain or a blood clot. The hemorrhagic stroke is a bleed, a ruptured blood vessel in the brain, which can also cause extensive damage to the brain.
When you work with patients that have either or of these strokes, is there a difference in treatment or is a difference in improvement?
There definitely could be a difference. Every stroke is different. It depends on the type and where the brain was affected.
And here's something interesting, and I know this is something you see in your practice as well. When you think stroke, you associate it with older adults, something you get as you age, but really we're seeing a lot of younger patients have strokes, correct?
Correct. In my practice, I've actually treated a 6-year-old who has suffered a major stroke. So it could be anywhere from young to old. It really affects all ages.
And you work with all patients of all ages, correct?
Correct. I work with all ages.
Oh my goodness. Okay, so I'd like to remind our viewers that if you have a question for Dr. Corsa this hour, you can call in and use that number 855-796-4475. We'd love to hear from you. Now, when someone is having a stroke, every minute counts. And if you learn how to recognize the telltale signs of a stroke, you can act very quickly and save a life, maybe even your own. So check out this video from the CDC that has more.
When someone is having a stroke, every minute counts. Just as putting out a fire quickly can stop it from spreading, treating a stroke quickly can reduce damage to the brain. If you learn how to recognize the telltale signs of a stroke, you can act quickly and save a life, maybe even your own. For both men and women, look for these 5 signs of a stroke, all of which come on suddenly. 1. Numbness or weakness in the face, arm, or leg, especially when felt on just one side of the body. 2. Confusion, including trouble speaking or understanding speech. 3. Trouble seeing from one or both eyes. 4. Trouble walking or problems with balance or dizziness. 5. headache, especially a severe one that comes on suddenly. The clock begins ticking as soon as you spot the signs of a stroke, because some treatments can only be used if the patient reaches the hospital in the first 3 hours after symptoms appear. So don't wait. Call 911 right away and get the person to a hospital immediately, even if the symptoms go away. If you think someone is having a stroke, remember the word FAST. F is for face. Ask the person to smile and check whether one side of their face is drooping. A is for arms. Have the person raise both arms and see if one arm drifts downwards. S is for speech. Ask the person to repeat a short phrase and notice if their words sound slurred. And finally, T is for time. If you spot any of these signs, call 911 right away to get the person to a hospital fast. Strokes are medical emergencies. The sooner a patient gets treatment, the better their chance of a good recovery.
And that acronym is literally life-saving. So let's talk about FAST a little bit. Let's go over that. So these are the signs to look out for and to recognize if you or someone you know is having a stroke.
Absolutely.
Okay.
So really important, the face. You can actually start seeing the drooping face, just one side, or an abnormal smile, an asymmetrical smile. Okay. You can have arm weakness. You might pick up the pen and it drops, or lift your arm and it feels really heavy. This speech, S, you can have slurred speech. Definitely just, or even unintelligible, or the inability to produce a word. And time is of the essence. You must call 911 immediately.
I said time is brain, as they say?
Correct.
Time is brain. So do these progress and get worse? Or, I mean, how does it, when you're having a stroke, is it immediate, or is this something that through minutes or even hours can just get bad?
So the stroke evolves. It's really important to get to the hospital immediately. There are medications out there, such as TPA, that can dramatically reduce the effects of a stroke.
Right.
So if you're recognizing those symptoms, you have to get to the hospital right away.
Okay, so we also hear sometimes people say they've had a TIA, which stands for a transient ischemic attack. So what is the difference between that and a stroke?
A TIA is often referred to as a mini stroke.
Okay.
It's a much less intense stroke, but it can really be the same. You can have the same effects, just less dramatic.
Okay. Now you say that sometimes these TIAs go misdiagnosed or even underdiagnosed, correct?
Correct. The patient could go to the hospital and get a scan and it's not seen because the stroke hasn't really evolved.
Right.
So they're very misdiagnosed. Some doctors could say you're just dehydrated or you're just weak. So unfortunately, I see this often.
So what do you do in that case? If you're going to the hospital and it does not come up, you can't see it, the person goes home and will they have a stroke?
If you do see or feel and they discharge you from a hospital and the symptoms are still persisting, you must go back.
Okay.
You absolutely, because the stroke could be evolving and turn into a larger stroke. In fact, 80% of all TIAs, some of them could lead into a larger stroke.
So once you have a stroke then, are you more likely to have another stroke in the future?
Correct. Once you have a TIA or a stroke, the likelihood of you having a second one is pretty high. You do need medical intervention.
So at what point, Lisa, do they, Dr. Corsa, do they come to you? And is it right after a stroke or is it a couple of weeks? Because I imagine that getting back up and running and using that function is so important.
Well, they first see a neurologist, so it's part of the rehab team. The neurologist is the doctor who classifies the stroke. And then they could be prescribed the physiatrist, who is a medical doctor who assists in the rehab team. Then we gather the large team. So they would come to me maybe 1 week or 4 weeks or even 6 weeks after.
And they're with you for a period of time. I want to go back to, we were talking during the break and I was left speechless. You mentioned you had a 6-year-old patient who suffered a stroke.
Correct. I had a 6-year-old boy who came to me who had a massive stroke in the ocular, the back portion of the brain, that really came in as a vision difficulty. Again, often misdiagnosed. It was more of a TIA, blurred vision, a little impaired speech, nothing dramatic. He suffered a massive stroke and really turned into almost a 3-month-old baby. Wow. Inability to do anything, walk, talk, back in diapers again. was a very sad case, but fortunately, through intensive therapy, had made a full recovery.
And this, well, how long was this process? I can't believe a 6-year-old can have a stroke. You don't even think about that.
Right. This process took several years. He was in my clinic for 4 years. It was intensive, so it can take a long time.
Amazing work that you do, Lisa. Now, the effects of a stroke can be lifelong, but with the use of physical therapy and rehabilitation, many patients are able to regain brain function as well. Now, coming up next, we'll hear more on the care and treatment following a stroke. You're watching the Health Channel, All Health, all the time on South Florida PBS. If you have a question for Dr. Corsa, please call in using the toll-free number 855-796-4475. You can also visit our website, allhealthtv.com, where you can watch the Health Channel live 24/7. And also you can download the Health Channel app for your mobile device or smartphone. It's free, available at the App Store or Google Play, and you can watch full episodes like this one. We'll be right back.
Stuck in traffic? There's an easier way to see a doctor, right from your phone. Download the Baptist Health Care On Demand app today to enroll for free.
Hey there. So what's going on today? Can you open wide for me, buddy? Okay, I see what's happening.
Care On Demand from Baptist Health, the better way to get better.
My journey started with one step. I was diagnosed with diabetes and I was on a downward spiral. I use running to find myself, but I also incorporate some of the eating habits that I learned as part of the Florida Blue pre-diabetes program. It just ignited a fire in me. Before I knew it, I was up to 40, 50 miles a week, and I've done 15 5Ks in the last 12 months. I'm not fastest, I'm never firstest, but I finish shedding all the weight, all the bad habits. It's just been amazing. I love being the healthiest version of myself that I can be. The one step became 10,000 steps. Then the one choice became a lifestyle. I'm Rita, and this is my kind of blue.
Eva Marie smoked 12,000 packs of cigarettes over 15 years. She quit, and now there's a new lung cancer screening that could save her life. You stopped smoking. Now start screening. No matter how much you smoked, early detection could save you. Talk to your doctor or learn more at savedbythescan.org.
Hi, I'm Kathy Buccio with the Health Channel Refresh, Reflect, and Recharge at a one-day retreat at Intercontinental Doral, Miami on Saturday, June 1st from 9 to 4 p.m. Brought to you by Susan G. Komen of Miami Fort Lauderdale and Miami Cancer Institute. Participate in panel discussions with experts and engage in mindful activities to reflect on your experience. Register for free and go to KomenMIAFTL.org/June 1st. We'll see you there.
Smart lights, smart locks, smart thermostats. You love your new connected technology, and the Consumer Technology Association wants to help you protect the security of your devices. First, don't use default or easy-to-guess passwords. Create unique ones and keep them safe. Next, look for and install security updates from device manufacturers. Also, have an active firewall for your home router. And consider using a professional installer to set up your new devices. Easy tips from the Consumer Technology Association to help keep your devices secure.
Welcome back to the Health Channel, All Health, all the time. I'm Kathy Buccio, and with us is Dr. Lisa Corsa, physical therapist, manual osteopath, and athletic trainer with Premier Therapy Solutions. If you have a question for Dr. Corsa, please call in using the toll-free number 855-796-4475. We'd love to hear from you. Now, rehabilitation is a key component to treating patients who have suffered from a stroke. In fact, one man who had a stroke said that he went through during his recovery inspired him to become a physical therapist. Take a look at his story.
I decided to join the Coast Guard because I love to be out on the water. I like to be around the water. I like to be on the beach. I am very proud of my time I spent in the Coast Guard. It really taught me that I need to adapt and overcome. I was in the Coast Guard for 3 years, made a lot of really good friends, and I advanced really quickly and I was thriving. Then all of a sudden I was having headaches for probably about a week, and they were just excruciating headaches. And then all of a sudden I woke up on a Sunday morning and then I had the aneurysm ruptured and I collapsed on the kitchen floor. That really changed my life.
So that was a Sunday morning, and I was actually visiting my sister in New York City, and I got a call from my daughter that something happened to Sean.
We got the news when Emily called, very distressed, that Sean had been taken to the Mayo and he was unresponsive. So I got her on a plane, like immediately, to Jacksonville, and she flew out.
So when I did get to the Mayo Clinic, we had an interview with Dr. Talk and Dr. Freeman explaining exactly what happened with Sean. It was a very scary time because we had no idea if he was going to live or die.
They wound up inducing me into a coma for about 3.5 weeks.
And I spent 24 hours a day with Sean. I didn't leave his room.
When I first woke up, I started going through those different stages of grief.
Because he couldn't take care of himself. He basically couldn't do anything for himself. For many months, he could barely lift a finger.
I started, feeling sorry for myself, wondering how in the world am I ever going to be able to recover from this when I can't even move my body and I can't even talk. Things started to change when I started with physical therapy, and at first they were really slow, and then all of a sudden I went back to the Mayo Clinic to have another surgery to replace the section of bone that they had taken out of my head. And when I got back is when they started noticing the biggest change in my recovery. I started walking after that, and I started being able to take steps.
By middle of February, he started walking with a walker. By the end of February, he was walking with a cane. And then the next day in March, he said, no more, and started walking on his own.
I basically started talking as well, and it was just a huge improvement.
By the end of August, Sean was driving his own truck. And by October, he was enrolled in school to become a physical therapy assistant.
I decided to be a physical therapy assistant because I regained probably about 90-95% of my ability, and I had that experience of losing completely everything and having to regain everything, and I figured I'd be able to help others. I look forward to the future now. The future is going to be me working in a hospital, hopefully helping other people that are going through the struggle that I had to go through, and maybe I can give them a little bit more inspiration, and hopefully that'll, light a fire under somebody and get them up and get them moving.
Such an inspiring story, but you and I were commenting how important it is to also address the emotional components in this as well. I mean, I'm looking at Sean's story, and here's someone who was part of the Coast Guard, such a full life, and to this to happen. But yet, thankfully, a very happy ending. But do you often see that?
Absolutely. There's no question that emotional therapy, psychiatry, psychology is a big part of the team we need to be addressing. Mm-hmm. Being positive and positive reinforcement, these people's lives completely change.
They do. Now, he said he regains 90 to 95% of his brain function. So is it difficult to get to that level of recovery? I'm watching him from that moment he's in that hospital bed, and my first reaction is thinking, wow, will he recover from this? And here we see him.
Technology has advanced dramatically. These patients do recover. This is not uncommon to see. These patients can get almost full function back.
So let's talk about the rehabilitation, because this is a team approach. This is not just one person. So how does this work when a patient comes to you?
So the team really consists of a group of doctors. We start with the neurologist who classifies the stroke. Then we could get the physiatrist, who is an MD who specializes in the stroke. We also have the physical therapist who deals with the large gross motor movements, the occupational therapist, the fine motor movements, speech pathologist, dietitian, and social worker, again, to assist with the house.
So I want to bring up the dietitian as well. Is this because patients need to be on a different diet, or is it mostly because they're learning how to eat again?
Well, the speech therapist actually assists with learning how to eat again, talk. The dietitian really assists, yes, with the proper food. Food is medicine. We all do know that.
Right.
Really, they need to get back on a better diet, maybe a Mediterranean diet. It's very helpful, one that's low in fats, dairy, and things like that to really properly heal.
Now, you as a therapist and osteopath, how do you work with the team?
So as the physical therapist, I'm really in charge of the gross motor movements, the large independent movements, walking, getting them out of bed, moving again, moving their arms and limbs. So we really deal with that.
Okay, so sometimes I even get confused. So what's the difference between an occupational therapist and a physical therapist?
So the occupational therapist really deals with the fine motor skills, the tactile, the hand buttoning, zipping. They do work on dressing and bathing.
So everyday tasks?
Everyday tasks. How do you put your shirt on again?
Wow.
Need to teach them that.
Okay, and you work together with the occupational therapist, correct?
Correct. It's a team approach. We work together doing all of the things, and a lot of times we often co-treat.
Right. Okay, so I'd like to remind viewers that if you have a question for Dr. Corsa this hour, call in. That number's 855-796-4475. We'd love to hear from you. Now, as we've discussed this hour, having a stroke can lead you with some debilitating long-term effects. Now, Dr. Corsa, can you give us some examples of some of these disabilities and how difficult it can be for some patients?
Absolutely. Movement is the key factor. They can't move their arm. They can't walk. The leg doesn't move. They lose sensation, numb. They don't feel. They have slurred speech. They can't make intelligible sentences or words. Very often, difficulty swallowing. Absolutely, that's where the speech therapist comes in. Cognition, their memory loss, impairment, the emotional outburst or outbreak. They could laugh or cry suddenly, get angry. And we really need to touch on bowel and bladder. Sometimes they do need to go back in diapers, or depends. They lose the bowel and bladder control, and a pelvic floor therapist is an important part of the team.
You described it as almost you're going back to being a baby, almost, teaching all this again.
I have seen massive strokes where the patient literally is back to being a child. 2-month-old, 3, they can't even sit up. They don't know how to crawl. They can't walk. They can't feed themselves and they're in diapers. It really is going back to the neurodevelopmental levels, and that's where we formulate our rehab principles.
Now, by looking at these impairments, do you often see patients that have all of them, or will patients just show a few?
Depending on the type of stroke, these patients could have a massive stroke with every single one of those impairments.
Right.
Or they could just have their one finger doesn't move. Right. And that really matters on the effect of the brain.
So that was my next question. It depends really where the stroke happened, where in the brain exactly, and that kind of determines these impairments?
Correct.
Okay.
The brain dictates everything. The brain is contralateral. So if the brain is in the right side, then it affects the left side of the body.
Okay.
Or if it's in the cerebellum, that's the back of the brain, the patient will have difficulty with balance. The occipital lobe, you could have vision difficulties. There could be blind or blurred vision. So it really does affect, depending on where the brain is. Every stroke is different.
So now here you come in as a physical therapist. What does it do to the brain? What does the physical therapy do to the brain? It reteaches?
Yeah, absolutely. The physical therapy reteaches the brain through neuroplasticity.
Okay. Right. Now, what is that, neuroplasticity?
So neuroplasticity is the basic building block of retraining the brain, regrowing the neurons. This is my foundation for how the patient could get better. 10 years ago, or even 15 years ago, we thought the brain couldn't regrow. We have evidence in the research the brain can regrow through neuroplasticity.
So then how do you activate that neuroplasticity?
Through physical therapy, we reactivate repetition, 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 intensity, and timing.
Do you use that approach as well for other, let's say, neurologic conditions besides a stroke?
Absolutely. Great question. Neuroplasticity is effective for Parkinson's disease, stroke, MS, all different kinds of traumatic brain injury.
Okay. How involved is the actual patient himself, not just in the physical therapy, but let's say a patient can't speak, can't walk. How are you able to communicate how much that patient can do, or if you know at that point if the brain is relearning what you're teaching it?
So there are many scans out there. There's triple SPECT imaging, MRI brains that can show where the exact location is. They're fascinating.
Right.
And then if someone can't speak, we use vision boards, or there's really unique technology out there that can understand your emotion and speak for you. So a lot of great technology.
Does the severity of the stroke affect the neuroplasticity?
Correct. The severity of the stroke affects the neuroplasticity and how long you're going to be in rehab. So really, the longer the stroke or the more severe, you're going to be in rehab several years.
Okay, that's very common.
Very common.
You can see patients as short as a couple of months to years.
Correct. I would say maybe 3 months is the typical timing of a basic stroke.
Okay.
But a massive stroke, like a locked-in syndrome, which is a really severe stroke, that can take many, many years to recover.
Now, when we come back, we're going to show you exactly how Dr. Corsa works with some severely debilitated stroke patients to show them how they can truly walk again and get back to normal life. You don't want to miss that. You're watching the Health Channel, all health, all the time on South Florida PBS. If you have a question for Dr. Corsa, please call in using the toll-free number 855-796-4475. You can also visit our website, allhealthtv.com, where you can watch the Health Channel live 24/7. And also you can download the Health Channel app for your mobile device or smartphone. It's free, available at the App Store or Google Play. We'll be right back.
A brain aneurysm doesn't care if you're busy. It doesn't care that you have important meetings. It doesn't care that you have to drop your daughter off at ballet and your son off at soccer practice. And if you ignore the warning signs of a brain aneurysm, you'll realize too late that the meeting wasn't that important. No meeting is. That you'll never see another soccer game, and that your daughter won't see you in the audience at the big recital. So if you suddenly experience the worst headache of your life, sharp pain behind your eye, and blurry vision, don't ignore it. Seek immediate emergency care, because your family is counting on you to take care of you. The Lisa Calagrassi Foundation, shedding light on brain aneurysms. Learn more at lisafoundation.org.
There's a better way. With Baptist Healthcare on Demand, you can see a Baptist physician from any mobile device or PC anytime from anywhere.
How can I help you today?
Oh, hi. Go to baptisthealth.net/care on demand to enroll for free today.
Cancer doesn't run in my family. That really was the farthest thing from my mind. I've been an athlete my whole life, and I work in sports, so my mindset was just, let's fight. So our stories are all unique, so whatever you're going through, ask questions, get information, and be involved. Don't ignore the signs. Join the fight. I'm Tony Beasley, and I'm a stage 2 colorectal cancer survivor.
welcome back to the Health Channel, All Health, All the Time. I'm Kathy Buccio, and with us is Dr. Lisa Corsa, physical therapist, manual osteopath, and athletic trainer with Premier Therapy Solutions. If you have a question for Dr. Corsa, you can call in using the toll-free number 855-796-4475. Okay, so when it comes to physical therapy for stroke patients, let's say, who often need something called aquatic therapy, what is it that you do with them, Dr. Corsa?
The aquatic therapy is really unique. It's putting the patient in the pool, so they don't have this large, heavy gravitational force on them, and they can't really move their limbs anyway because they're so weak.
Right.
So the pool takes it all away. It's really neat.
So I imagine because you're in the pool, it's a lot easier for them to move around as well. They feel comfortable. They can push themselves a little bit.
Correct. In my pool, as you can see, it's really unique. We have special cameras in the pool, and we can allow patients to we have therapists in there that move their limbs.
There's a screen there as well in front of the wall. So what does that show?
So that is a visual biofeedback screen. The patient can physically see, and so can we, their limbs moving, which is a really important part of therapy.
Okay, and what way? What do you think? It motivates?
Correct. It motivates and enhances the neuroplasticity biofeedback mechanism in the brain.
If you have a patient that can walk whatsoever after a stroke, is this the first modality you use?
This is definitely the primary modality I use because it takes all of the pressure and the weight off of the limb. The limb is usually very weak. It doesn't move well. Most of the time it could be fully paralyzed. The patient can get depressed. The arm doesn't move. We will actually move the limb in the water, which really enhances the recovery.
Well, if they can't walk though and they can't move, how do they get into the pool?
So with my special pool, there is an elevator. They don't even have to get into the pool. We have a special elevator lift, so it drops the patient down into the pool.
Wow.
And we have a water wheelchair, so we bring the water wheelchair in the pool, so they don't even have to stand.
Okay, so let's see this in action. I'm curious to see how this works. We have a video of you with one of your patients, and let's watch.
Okay, shifting left. Left glutes on. Left glute. Perfect step. Shifting right. Shifting left. Now we're on right. Right glute is perfection. Beautiful. Look at this. Arm walking. You are walking. You are walking. You are walking. Shift right. Right glute. This is awesome. Shift left. Left glute. You are walking. You are walking.
That is incredible. But I need to make note, there are divers in that pool, literally holding the patient's foot, moving the foot as you're doing the therapy as well. And they're holding their breath down there.
Yes, yes. So we train them, our therapy divers, we train them to hold their breath for several minutes so that they can move their legs through the normal, proper gait cycle. So they are physically moving his leg forward and back because this patient can't move their own legs. And then we also have a therapist that's stabilizing the trunk, the head, the face, telling them to speak. So we do speech therapy at the same time.
Absolutely, you are. This is a team approach. I mean, that is so evident right there. And I hear you keep saying you are walking, you are walking. So why that repetition?
So we give that intense positive feedback. That verbal feedback goes into the brain so that the patient really knows and sees they're walking. And it really does improve their ability. So it's a wonderful modality. I constantly tell them they're walking.
And we have another video of you doing this with another one of your patients, and when our viewers take a look at this.
Perfection.
What are you doing right now? Love it.
Perfection. Yes. You are. I am. You are. Oh, this is so good. This is the way you do it. Neuroplastic gains.
This is how we do it.
Perfect. You are. Yes. Every day, you're getting better and better.
This is mind-blowing. I want you to share with our viewers what you just shared with me. This patient.
So this patient actually has not walked in about 15 years. She was wheelchair bound,
Wow.
very limited to the wheelchair. And when I got her, she had suffered a massive stroke and also has MS. So we did intense hours in the pool, up to 3 hours at a time.
Right.
We would be in the pool, moving her limbs, going through the cycle of normal gait pattern.
I noticed in this video, though, she had weights on her leg.
Correct. That's another modality we use. We put weights on to allow the joints to be what's called grounded. It's another form of neural biofeedback. It's incredible. We just bring them through the cycle. Right. And she also could not speak. So we really went into proper speech therapy with her as well.
How is this patient doing now?
When we left, she did 12 weeks of intensive rehabilitation. She was able to ambulate many, many steps on her own through better balance,
right,
and was able to speak proper sentences.
Oh my goodness, that's incredible. Oh, is that her?
That is her walking by herself after
wheelchair.
This was after 3 months of intense 4 to 6 hours a day.
What a journey. Wow. Wow. Does she have to continue therapy?
Yes. You know, most stroke patients really need to understand this is a lifelong process. There is absolutely, you know, a form of sensibility. They need to do it on their own.
Right.
So we give them a home program.
Okay. Now, I'd like to remind viewers that if you have a question for Dr. Corsa, you can call in using the toll-free number 855-796-4475. Now, when do you know it's time to move from, let's say, aquatic therapy to something else, or maybe add more weight to the body as well?
Once the patient starts regaining proper strength gains in their legs, we progress them to land. Land therapy is more intensive, a little more aggressive, but we do have harness systems on treadmills, so it will take off a certain amount of their weight. So here we're looking at one of the graphics. She's in our weighted harness treadmill. It's a very specialty treadmill. So I am physically moving her leg over and over again. She suffered a massive stroke through triple aneurysm brain bleeds, was not able to walk or talk. She was 2 years in our program and now is totally walking normal.
Incredible. Now, this is the results that we're seeing are patients who go to you right away, let's just say. But what if a patient has not done a therapy after a stroke, but then wants to go back?
I have definitely seen in my clinic someone who really had no intervention for 5 years. We're seeing through the research, through neuroplasticity, you can make some gains even 5 years post-stroke.
Right. Obviously the goal is to make these patients independent. Are you seeing that through the work that you do at some point, these patients doing the work, walking, talking independently without any help?
The goal is total independence.
Total independence.
And these patients do achieve, here she is, walking.
Wow, without your help.
Without our help. Mm-hmm. This is part of her process. And she is now fully independent. She has just an assistant, but really and truly fully independent. We may need some assistive devices.
Of course.
You could maybe use ankle brace. You know, there are arm braces. We'll get into that. But really the goal is full independence.
That's a beautiful thing. Okay, you also use something called forced use. What is that?
CIMT, constraint-induced movement therapies, or forced use, is in the research, evidence-based. I really am applying the research to clinical practice. Okay. We make the paralyzed limb work. So even when it doesn't want to work, we force it to work through electrical stimulation, through me physically lifting it. I make the limb work.
So I'm assuming with all these different physical therapy modalities, it takes time. So does that mean that every patient is different in their approach?
Correct. Obviously, there's no guarantee, and I try to really use prognostic indicators to tell the patient how well they're going to do. Every stroke is different, but in my practice, I've just seen dramatic gains with every patient because I use and emphasize repetition, intensity, and timing.
And just as important as we've been discussing as the physical therapy is, that positive outlook is just as important, as you said, believing in yourself, knowing, as you say, with the positive reinforcements that they can get better. So how important is that kind of outlook when you're diving into work like this?
Greater than 50% of these patients who have a positive mindset improve. You must think positively. You must keep looking at videos of your old self walking.
Right.
You must look and say, I'm going to do this. Use visual imagery, positive brain feedback, and meditation saying you are going to get better. Really does work.
Absolutely. Now we have more to come on rehabilitation when we come back, so stay tuned to hear about new interventions. They're a real game changer when it comes to recovering from a stroke. You're watching the Health Channel, all health, all the time on South Florida PBS. If you have a question for Dr. Corsa, please call in using the toll-free number 855-796-4475. You can also visit our website, allhealthtv.com, where you can watch the Health Channel live 24/7 and also download the Health Channel app for your mobile device or smartphone. It's free. You can watch this show specifically, and you can get it at the App Store or Google Play. So we'll be right back.
A brain aneurysm can strike you when you least expect it, plunging your entire world into darkness. But if you know the warning signs, you're much more likely to survive. If you suddenly experience the worst headache of your life or sharp, sudden pain behind your eyes, do not ignore it. Please seek immediate emergency attention. It's time to shed some light on brain aneurysms. You gotta know the information.
The Lisa Calagrassi Foundation, lisafoundation.org.
A double lung transplant is probably the most difficult surgery you can get. Being able to breathe, it is a feeling that you want to rejoice. I always thank the donor. I thank Florida Blue because my case manager was responsible for getting liquid oxygen that I needed when no one else could. It's what kept me alive. I'm Ed Henry, and this is my kind of blue.
Many websites selling medication may look professional and legitimate, but the vast majority of sites selling prescription drugs are doing so illegally. Criminals use websites to sell counterfeit medications that may contain life-threatening toxins. Dot Pharmacy is a website verification program that helps you identify safe and trustworthy online pharmacies. Purchasing medicine online can be safe and easy. Just look for pharmacy to the right of the dot in website addresses.
$145 over 92.
180 over 111. 182 over 100. And I had a heart attack and a cardiac arrest. And then a stroke.
This is what high blood pressure looks like. You might not feel its symptoms, but the results from a heart attack or stroke are far from invisible or silent.
My memory is shot.
When I woke up, I couldn't speak.
I can't button up a shirt. I can't run. I've had to learn to swallow again. That's the only moments that I have. And I'm 33, so I never see this coming. If I would have followed a treatment plan, I would not be in this situation.
Had I done this, had I done that, hell, I messed up.
Get back on your plan, or talk with your doctor to create an exercise, diet, and medication plan that works for you. Go to loweryourhbp.org.
Head to toe, everything's changed. Head to toe.
Welcome back to the Health Channel, all health, all the time. I'm Kathy Buccio, and with us is Dr. Lisa Corsa, physical therapist, manual osteopath, and athletic trainer with Premier Therapy Solutions. If you have a question for Dr. Corsa, you still have time to call in. That number is 855-796-4475. Now, there are many types of interventions used for stroke rehabilitation. In fact, robotic therapy is something that has shown to be very helpful in helping patients regain their function. Let's watch this video.
Well, the importance of rehabilitation after somebody has a stroke is to help them regain their functional independence as much as possible. Often when someone has a stroke, in many cases, unfortunately, they don't have a complete recovery, no matter how good the acute treatment, so they're left with weakness in an arm or a leg, speech difficulty, vision problems. They're not able to take care of themselves, to walk normally. So the goal of the rehabilitation is to get them doing as much as they can for themselves, to try and get them as independent as possible. The idea of this is that the individual can, they put their weak arm in the tray on the robot, and in response to an interactive video interface that's a lot like playing video games, they try and hit a target on a screen, for example, or do other activities. So if the person, for example, can't move at all, the robot will take them through the motion. If they can perform the activity partially, but not completely, the robot will let them do what they can and take them through the motion. If they start to move in the wrong way, the robot will correct the motion. This results in improvement in the patient's ability to utilize the muscles, to do functional activities, and we think it works by retraining or activating certain pathways in the brain.
The recovery's come very well. I got out of the hospital February 2nd, and I'm already walking free. I'm moving free. My arm isn't moving 100%, but they tell me it will soon. The first, I was laughing for everything because it was the first time I had ever seen it. Yeah. I never worked with a robot. And then once I got it going with my own arm, I loved it.
That's a pretty neat technology right there. So do you use robotic therapy as well?
Yes, robotic therapy is just fantastic. I have a bionic leg in my office that really assists with moving. They have bionic arms. They even have exoskeletons that can harness the whole patient and move. They're fantastic technology.
But there's different types of robotic therapy, correct?
Correct.
Okay.
There's one you can use on a treadmill to actually walk with, and then there's one specifically that provides feedback for the strength of the arm. It can measure the amount of strength the arm has and give a certain amount to assist.
So it can, from start to finish, as long as you start the robotic therapy, it'll tell you how much you've improved?
Yes, there's objective measures on that. It can tell you how much you've regained the strength.
Amazing. Okay, there's something else called mirror therapy. What is that?
It's just a wonderful use of a mirror, very inexpensive device, where you put the mirror on the affected leg, so you cover the affected leg. So when the patient does exercises, you exercise the good leg, the leg that's not paralyzed. So when the patient looks in the mirror, they're actually tricking the brain, thinking it's the affected leg. So it's a fantastic modality and regain strength back.
And probably a least expensive form of therapy.
Very, very.
All you need is a mirror.
Correct, because these bionic legs can be very expensive, so a mirror is wonderful.
Now we have a few minutes left in our show, so if you have a question for Dr. Corsa this hour, be sure to call in using the toll-free number 855-796-4475. Now, I want to show a list to our viewers of some additional novel interventions that show some promising results as well. So explain each of these for us, Dr. Corsa. The first is sensory brushing. What is that?
So I use a special brush because patients lose the ability to feel their skin, numbness or tingling. It's a therapy brush. Neuromuscular stimulation. As you know, these patients are paralyzed or the limb is weak. This is an electrical stimulator to strengthen the muscles. Really, really important. I might use 6 or 7 of those devices on at one time. Vagus nerve stimulates the organs in the brain, the breathing. The laser therapy can assist with shoulder pain or arm pain. It provides a vasodilation effect, so it dilates the blood vessels. Cranial osteopathy helps with the movement of the blood flow in the brain, and then osteopathic mobilizations to reset the alignment.
Okay. Now, are these part of clinical trials as well that you can use patients in? Do you take part of that and, let's say, do some of these as well?
So those interventions are a collaborative approach. I may use all or some of them with our patients. Some of them are being used in clinical trials.
Okay.
And there's many trials out there. So the patient should look to to see if you're a candidate.
So how do you get involved?
So one of the ways is you can go on the website clinicaltrials.gov. That is our national database. And we do help look for you to see if you're a candidate. It really depends on the type of stroke.
As we've been discussing for this hour, all the modalities and the different ways to get back up and running, I would say, I feel a little overwhelmed. There's so many options out there. So how does the patient know what's going to work best for them, or how do you know what's going to work best for a patient?
Definitely, I would speak to your neurologist. The neurologist is leading the team. They really know what centers are out there. There's large rehabilitation centers in the country. And then go to the team. You know, the physiatrist or the physical therapist can help guide what therapy interventions would be best for you and how long you need it.
So we often hear also someone might want to include, let's say, acupuncture, maybe another holistic form of therapy. How does that work?
So there are definitely holistic forms. I found that acupuncture can help with anxiety, the emotional component. We talked about that.
Yes.
You know, these patients can get depressed. They're in a wheelchair. So acupuncture can help with that. There's also hyperbaric therapies.
What is that?
Hyperbaric is an oxygen therapy that delivers to the brain. There's hyperbaric centers all over the United States. There is some promising research out there, if you look in the literature, that it can help bring oxygen to the brain.
Right. Now, you also work with patients on their eating, and then once they're done with some maybe potential exercise regimen as well. So how does that fit into the plan?
As part of the team, the nutritionist is a big person that should follow them through. Staying healthy, eating a Mediterranean diet, keeping a healthy body weight is really important. Lots of fruits, vegetables, low fat, no dairy diet, no red meats. Vital for the health and longevity of the patient.
Right, and heart healthy as well.
Heart healthy, low sugar, really important. And then keep moving. Movement is important. We give exercises for the nursing, the caretakers to really say, do this every day. Don't stop and don't give up.
So the work doesn't stop after physical therapy or after your rehabilitation is done. This patient has to go home and do the work. Like you said, it's lifelong.
This is a lifelong process. We give them a full book, picture book that says, you know, do these 10 exercises every day. Do not stop.
Right.
Movement is the key.
I want to switch gears really quick and talk about that emotional factor. First of all, starting with you, how emotional is it for you working with a patient from start to finish, whether it be 3 months or 4 years, and seeing that progress that patient makes?
It's very emotional. I do give my 100% into this person. You know, this might be a person who had a full-time job, they can't work anymore, and they're now depressed and in bed. It does drain. It takes an emotional component and can be draining. So that's why this is so important to seek that help. We really motivate the person to keep going every day.
And one of the things we were discussing off camera is the importance of family and how this becomes it's a family condition, and not only that, the rehabilitation, the family is really involved, and you see it firsthand.
I do. I never forget the caregiver. We must mention that caretaker. They get burned out. They need therapy too. They really do. Offering them a massage or some exercise, you know, just to get them out there. We have to focus on them too. They've got to be able to care for this patient.
As you were saying as well, you see them for hours, but these families, they're with them all day.
They're with them all day, and they really need help. So when they're around, give them, you know, a lend ear, let them just talk and vent out their concerns. You know, give them a pat on the back. They're doing a great job. Right. Really important.
Okay, I know that you wanted to mention prevention as well, and this can be as simple as getting a screening. Can you tell us a little bit about that?
We've had some famous people, you know, die of strokes recently in the news. We must go to our primary care physician and ask prevention. There are prevention screenings, prevention brain scans that you can get. Talk about your symptoms to your doctor. Get the proper blood work. See if you're at risk for having a stroke. Prevention is the key.
Any final tips? We've talked a lot about strokes and rehabilitation. Any final words?
Final words. Don't stop moving. Exercise, exercise, maintain a healthy weight, and keep moving.
All good tips. Thank you so much, Dr. Corsa. Thank you so much for being here. Be sure to join us next time on the Health Channel. All Health, all the time on South Florida PBS. Follow us on Facebook, Instagram, and Twitter at All Health TV, hashtag All Health TV, where you can get health tips from our experts and see what's coming up on the Health Channel. You can also visit our website, allhealthtv.com, where you can watch the Health Channel live 24/7, and also download the Health Channel app if you haven't done so already for your mobile device or smartphone. It's free and available at the App Store or Google Play. I'm Kathy Buccio. We'll see you next time.